Welcome to the webinar entitled New Concepts in Body Sculpting, Fat Reduction and Skin Tightening in a Single Treatment. My name is Dr. Andrew Nelson. I've been very fortunate to train at prestigious medical institutions, including Johns Hopkins for medical school and a dermatology residency at Harvard, followed by cosmetic and surgical training at UCLA. I'm currently in private practice in St. Petersburg, Florida, where approximately 50% of my practice is cosmetic dermatology and 50% is Mohs surgery for skin cancer. I've utilized the InMode device in my office for over a year and been exceptionally pleased with my patient outcomes, their satisfaction, and my investment. We're going to be talking about the InMode aesthetic platform in this webinar, focusing specifically on non-invasive body contouring and cellulite treatment. As we all know, non-invasive aesthetic procedures have increased dramatically in the last decade. Specifically, the areas of body shaping and skin tightening have increased by almost 20% in the last 5 years. And why is there such an increase in this area? Well, we are getting bigger. In the last 40 years, the average American man has a 5-inch increase in his waist size, while the average American woman has a 7-inch increase in her waist size. In short, there's an obesity epidemic. And with this epidemic among us, we are all trying to lose a little bit of weight and have a better body. So what do people want? Well, we'd like to be in better shape. We'd like to lose some excess weight and get rid of extra fat. Particularly, most of us want to focus on the trouble areas like around the abdomen, the love handles, the back. And ideally, we'd like to do it in the quickest, easiest manner possible. In short, we all want something for nothing. And while many of us have gone to the gym and walked for hours on the treadmill, as these people are on the left, sometimes we feel, myself included, like the person on the right. He's hot, he's sweating, he's at the gym, and maybe he's just not getting the results that he's looking for. So can't there be a better way than just going to the gym? Well, historically, that was liposuction. And liposuction is still a wonderful treatment for large volume fat removal. But the downsides to liposuction are that it's an invasive surgical procedure. It can be quite painful. There's downtime and healing associated with liposuction, and it's an expensive treatment. So increasingly, patients are seeking non-invasive treatments. Ideally, it would be great to treat the underlying fat without the invasive procedures such as liposuction. Many different technologies have been developed with this in mind. Some have specific effects on fat, some do not. As a result, some technologies work better than others. And just as an example, these are just some of the treatment options that are available for non-invasive fat and body contouring. So how do fat devices work? Well, many devices don't actually directly target subcutaneous adipocytes. Instead, they non-specifically heat the dermis. And with mild dermal heating, you may see some adipocyte apoptosis, but this is not a specific effect on adipocytes, and as a result, it is not quite as effective of a treatment. Better non-invasive devices try to directly target fat cells. That is, they try to cause specific apoptosis and cell death of the adipocytes. And technologies like this include cryolipolysis, ultrasound, and in this case, radiofrequency. So what is our ideal non-invasive fat reduction treatment? Well, it would be perfect if it could directly and specifically target fat. We'd like to remove or destroy this fat through a natural, safe mechanism, ideally apoptosis. We'd like this treatment to be non-invasive with mild or no discomfort. Finally, we'd like, and this is an important one, we'd like to also treat and tighten the skin in the area. If you're going to reduce the subcutaneous fat, if you're going to melt away or remove some of that fat, you don't want to then be left with loose, saggy skin in the area. Several devices have this as a complication. So with these sort of ideal parameters in mind, I believe that radiofrequency is an ideal technology. And that's what we're talking about here with the non-invasive body contouring and cellulite treatment known as BodyFX. BodyFX is a radiofrequency device that is currently FDA cleared for the temporary reduction in the appearance of cellulite. So some of the applications that we're going to be talking about in this webinar can be considered off-label uses of the device. So what makes the BodyFX device different from other technologies? Well, it causes direct apoptosis of the adipocytes, of the fat cells. This causes reductions in subcutaneous fat thickness, as well as a reduction in the treatment area circumference. In addition to this direct effect on adipocytes, it also tightens skin in the treatment area. This causes more compact, densely formed existing collagen, as well as stimulating and increasing the production of new collagen, known as neocollagenesis. So the BodyFX is really the first device to simultaneously directly reduce fat as well as tighten skin in treatment areas. And it does this through a couple of steps. Step one is an initial radiofrequency heating of the dermis. And what you're using here is radiofrequency energy to remodel collagen. There is also some initial heating of the adipocyte and triglycerides. Then step two is a proprietary radiofrequency energy that specifically targets the fat cells themselves. It targets the adipocyte cell membrane and initiates apoptosis of the adipocytes, of the fat cells. This is a thermally triggered function with synergistic amplification between all of the radiofrequency energy. And ultimately what this causes is cellular apoptosis, or death of the adipocytes, over a 10 to 14 day time period. There's no acute disruption of fat, rather you're stimulating your own body's natural mechanism, apoptosis, to remove greater volumes of fat. As a result, it's a safe and effective treatment. So step one, we want to use radiofrequency energy to heat the dermis. And what you're actually trying to do as you heat collagen, collagen is a triple helical structure. That is, it's three sort of strings wound around each other and held in place by intermolecular bonds. As you heat this collagen, the bonds that hold the three strands of collagen together actually break down. When this occurs, collagen is able to actually wrap more tightly, more compactly around itself. This creates tighter existing collagen. At the same time, while you're heating this collagen, you're actually stimulating new collagen formation, known as neocollagenesis. During this time period, you're basically remodeling the existing collagen and stimulating new collagen production, as well as having some effect on heating of the adipocyte adipose tissue. Step two, we then use radiofrequency energy to target fat cells specifically. Radiofrequency energy is used to increase the adipocyte apoptosis. And what we can see here is that in this area before BodyFX, we see nice, round, large adipocyte cells. Following BodyFX treatment, look at the cell membranes now. They're withered, they're beginning to decay. These cells are undergoing apoptosis. These cells will die and they will be naturally cleared by the body to reduce the amount of subcutaneous fat. This is what leads to permanent fat reduction. So in review, let's talk again about the BodyFX mechanisms. Well, the first thing that it actually does with the handpiece is it uses a vacuum system to draw up the skin and adipose tissue into the handpiece itself. Then we have an initial radiofrequency energy which is applied, and think of this as heating the dermis and the subcutaneous fat. You're beginning to heat the tissue and the collagen up to the range of 42 to 43 degrees Celsius. This is where skin tightening occurs. Then in step two, we use a specific radiofrequency energy to cause apoptosis of the adipocytes. You're actually causing focused cell death. This is what's leading to permanent fat reduction. A clinical and biological evaluation of a novel, non-invasive radiofrequency device for the long-term reduction of adipose tissue. This was a clinical study of the BodyFX handpiece. 21 patients were treated with 6 weekly BodyFX treatments to the abdomen. So we followed clinical endpoints in these patients. Additionally, 3 patients who had already chosen to undergo elective abdominoplasty were enrolled in the study. These patients underwent the same BodyFX treatment, but only on one side of the abdomen, while the other side of the abdomen was not treated and left as a control. Now, the beauty of this is that those patients who were then undergoing abdominoplasty were actually able to harvest that abdominoplasty flap and look at histologic endpoints, that is, actual changes in collagen and fat cells on the BodyFX treated skin versus the non-treated skin. All patients completed this study with no significant adverse effects. The BodyFX treatment, the abdomen is typically, when you're treating that area, it's divided into 2 zones, the right and the left side. Each zone is a little bit larger than a big handprint size. The treatment parameters that we utilized were an RF power of 40 watts, a frequency of 1 megahertz, a temperature cutoff of 42 degrees Celsius, and a pulse duration of 3 to 3.5 seconds. 2 treatment passes of each zone were performed. Each pass lasts approximately 5 minutes. So that's 5 minutes to each right and left side, and then a second treatment pass of an additional 5 minutes. This leads to a total treatment time of approximately 20 to 25 minutes. Significant clinical improvements, statistically significant improvements, p less than 0.05, were observed for multiple clinical endpoints 1 and 3 months after the completion of BodyFX treatment. There was a substantial reduction in abdominal circumference of nearly 3 centimeters, a reduction of the subcutaneous adipose tissue thickness, that is, the actual thickness of subcutaneous fat as measured on ultrasound, and there was nearly a 1.5 kilogram reduction in adipose tissue weight. Interestingly, there was a smaller reduction in overall weight. So what this means is that not only is the BodyFX device helping to reduce adipose tissue, it is specifically helping to reduce subcutaneous fat tissue weight. And this is just a clinical example of what we saw in the study. We have our before treatment and our after treatment. I think it's fairly obvious to say that there's a reduction in subcutaneous fat from here before to here after, but notably there's also a contraction and tightening of the skin in the treatment area. Just another example in profile, again showing before and after, a substantial reduction after the treatment series, reducing the subcutaneous fat volume as well as tightening the skin in the treatment area. Now, as I mentioned before, we also did this on patients who were undergoing abdominoplasty in order to actually demonstrate histologically what was occurring with these treatments. So the patients who were undergoing abdominoplasty provided histologic samples of both the BodyFX treated areas and the untreated control. This tissue was harvested and cultured so that we could assess adipocyte size and shape, the apoptosis rates, collagen production, and dermal thickness. And what we can see here in the non-treated versus the BodyFX treated is immediately at the time of abdominoplasty. In the non-treated area, you see those normal, nice, round adipocytes. In the BodyFX treated areas, you see fragmentation, withering, decreased size and shape of the adipocyte cells. After 14 days of culture, which was actually an accelerated culture representing approximately 6 to 8 weeks of actual time, again in the non-treated area, nice, round, fairly uniform adipocytes. In the BodyFX treated areas, you still see that fragmentation, the reduction in the size, and in an altered shape of the adipocytes. And then we then went on to say, well, what exactly was happening to these adipocytes? What was causing these changes? And what we found is that these changes were a direct effect of adipocyte apoptosis. And we did that by using a very specific immunohistochemical stain known as APAF1. And APAF1 stains cells undergoing apoptosis. In the non-treated area, approximately 1% of the adipocytes stain positive with this APAF1. In the BodyFX treated areas, as you can see here, you see positive staining of multiple adipocytes. Nearly 20% of the adipocytes stained with APAF1 in BodyFX treated areas. Well, what does that mean? It means that after the BodyFX treatment series of the adipocytes, they were undergoing true apoptosis at much, much higher rates than the non-treated skin. So what this shows is that BodyFX specifically increases apoptosis of adipocytes. BodyFX was also shown to improve collagen. What you can see here in the non-treated skin is you see sort of thin, loose collagen. Immediately after the series of treatments at the time of abdominoplasty in the BodyFX areas, what we notice is more compact, thick, pinker collagen. Additionally, the thickness here is actually reduced slightly here. And what that means is that the skin is being pulled tighter. That existing collagen is being heated, it's becoming more compact, and as a result, the dermis actually appears measurement-wise thinner because it is now much more compact. After 14 days of accelerated tissue culture, again, we see those same changes. Much thicker, denser collagen in the BodyFX treated areas. So the BodyFX histological effects. Adipocytes were observed to have decreased size and a much more withered abnormal shape. There were increased levels of apoptosis, nearly a 20-fold increase. There was also a reduction in dermal thickness with tighter, more compact collagen. Additionally, and this was data that I didn't show, there was a true increase in new collagen synthesis, neocollagenesis, of nearly 14%. So what does this study tell us, and what can our patients expect? Well, our patients can see a reduction in subcutaneous fat, nearly a 3 centimeter reduction in abdominal circumference. with a decreased thickness of subcutaneous fat. The fat cells will destroy themselves via the natural mechanism of apoptosis. Patients can also expect to see decreased weight, with the majority of loss being fat-specific weight. And finally, they can expect to see tightening of the skin with more compact collagen. And what this means is that when the fat is reduced, they will not be left with excess saggy, loose skin following their treatment. Again, just some examples. BodyFX reduces fat here before and after the series of treatments. You can see a nice reduction in subcutaneous fat. BodyFX also tightens skin. Here we see before and after a series of treatments. Again, BodyFX can do both at the same time. Here we see a very nice before and after with fat reduction, definite reductions of subcutaneous fat, as well as skin tightening in the treatment areas. BodyFX also works on back fat. We can see our before and after our series of treatments and a nice reduction. BodyFX also works on those love handle areas. In this patient, you can see a substantial improvement from before to after with a reduction of subcutaneous fat and a tightening of the skin in the treatment areas. BodyFX works on men too. Here in this case, before and after, we see a very nice reduction in subcutaneous fat as well as a tightening of the skin in the treatment area. So what about BodyFX and cellulite? Well, there are multiple cellulite treatments, and in my opinion, when there are so many treatment options, it's often because none seem to work all that well. So I consider cellulite to be an untapped market in many cosmetic practices. We need an effective, safe treatment option for cellulite. In my opinion, BodyFX is a great treatment option. So it's important to remember fat is not quite the same as cellulite. Although they're similar, it's best to actually think of these as distinct entities. Fat is really just an overabundance of structurally normal adipose tissue, while cellulite, in contrast, actually has a structural problem or abnormality. As a result, sometimes the treatment for fat and cellulite can differ. There are many ideas of what causes cellulite. The first is a skin architecture theory, and really what this means is that there's differences in the structure of how the subcutaneous fat lobules are divided and the connective tissue that separates them. There's also thought to be a hormonal component because cellulite is far more common in females than men, and it's really not seen in females who have not yet reached puberty. In fact, some people consider cellulite to be a secondary sexual characteristic of women. So let's talk a little bit more about the architecture. With female skin, the subcutaneous fat is separated by these thin fibrous strands, and typically these strands are oriented largely vertically, meaning going up and down perpendicular to the dermis, and this facilitates fat herniation into the dermis. And when the fat herniates up, it creates an uneven dermis, or sort of that dimpling cottage cheese uneven surface of cellulite. Male fat, on the other hand, has a crisscrossing fibrous septi pattern, an oblique pattern actually, that divides the fat cells into smaller units that are more resistant to herniation. And again, this is just sort of a schematic showing the difference. Here we see these small, thin, vertically oriented fibrous septi in a female, and again, these allow fat to herniate into the dermis, and as you can see, this creates an uneven dermis and that collagen and that cellulite type appearance, while on the other hand, males tend to have this oblique crisscrossing structural pattern in the subcutaneous fat, which is more resistant to herniation, more resistant to cellulite. Just a little bit more on the stages of cellulite. Stage 1, which shows dimpling only when the skin is pinched with no spontaneous cellulite. Stage 2, on the other hand, has spontaneous dimpling when standing. And stage 3, spontaneous dimpling and furrows when the patient is both standing and lying down. So why are all of these so important? Why is it so significant to differentiate fat from cellulite? Well, as we talked about in cellulite, the dermis plays a key role in the appearance of cellulite. Ideally, if we could thicken the dermis, creating more strong, dense collagen, perhaps this would help to prevent that fat herniation that causes cellulite. Ideally, we'd also like to reduce the volume of fat in the areas of herniation, so that not only are you improving the fibrous septi, improving the dermis, but you're also reducing the amount of fat to improve cellulite. So that's why BodyFX, in my opinion, is such a great treatment option, because it not only targets fat specifically, but also improves the collagen in the dermis to make an ideal cellulite treatment. And that's because BodyFX has what we call the triple effect on cellulite. Number one, it uses that vacuum suction mechanism. And what this does is it actually creates a mechanical stress on the fibrous septae and on the dermis. This helps to remodel those vertical fibrous septae in the areas of cellulite, decreasing sort of that pitted or indented look of cellulite. Secondly, the radiofrequency has a specific effect on fat. It causes adipocyte death via apoptosis. So this decreases the size of fat nodules. It decreases the fat that's present in cellulite. And the third effect is radiofrequency skin heating. As we talked about, as that skin, that dermis is heated, we're able to thicken it, make denser, more compact collagen, as well as stimulate new collagen formation, neocollagenesis. This further helps to decrease the herniation of fat cells and improve the appearance of cellulite. So this is a Vectra 3D analysis, which basically just shows, as you can see here, an area of cellulite, that area of dimpling, and then an area without cellulite. And what we use this for is this is a great way of helping to assess how much of a change there is in an area of cellulite following a treatment. Just an example before, and you can see some of these dimples, these furrows here, this appearance of cellulite on the posterior thighs, and then following the series of treatments, a very nice improvement. So BodyFX is an effective treatment option. It's effective in tightening skin and specifically reducing fat. It also reduces and improves areas of cellulite. And best of all, it does it through a non-invasive, no downtime procedure. So this is typically about the time that people begin to ask, well, is BodyFX safe? Absolutely. In these clinical trials, there were no significant side effects. No reports of scarring, discoloration, or any other permanent side effects. There were some mild side effects that are reported commonly by patients. Patients may feel a pinching like sensation, which is generally related to the vacuum device. Again, this is also using a heating mechanism, as we talked about, radiofrequency heat. So patients may experience a bit of discomfort or a warm sensation during the treatment. When the radiofrequency energy pulses are delivered, some patients notice a shock-like or prickle sensation. In rare cases, patients have developed transient bruising, although this is more likely related to the vacuum function rather than the actual radiofrequency energy itself. But again, no reports of scarring, discoloration, or permanent side effects in any of these clinical studies. And how is that possible? Well, it's because the BodyFX uses the ACE principle, or acquire, control, and extend. And this allows for optimal safety, efficacy, and reproducibility of the treatment. How does ACE actually work? Well, the handpiece, the BodyFX handpiece, incorporates several sensors: a high and low impedance sensor, a contact sensor, and an epidermal thermal or temperature sensor. It monitors each of these parameters 10 times every second. And what this allows you to do is to set the temperature, the goal cutaneous temperature and fat temperature, and then you're able to acquire that because it's following very closely how warm the skin is and how it's being heated. As the area is heated and treated, the device automatically and temporarily terminates the delivery of any energy once that pre-selected cutoff temperature is reached. So if the area begins to get too warm, the device automatically turns itself on. Now, as that area begins to then cool back down below that cutoff temperature, the device then turns itself back on when it's 0.1 degrees Celsius below that threshold. And in effect, the device sits there and sort of turns itself on and off, on and off, on and off, to allow you to maintain that exact ideal temperature. And what that allows us to do with this ACE idea is you are able to acquire the ideal temperature for the treatment area. You are able to control it because the device is automatically turning itself on and off, and you are able to extend that treatment for several minutes comfortably and safely for your patients. And that's what ACE means to you. It's the safest, most advanced RF energy delivery system. The temperature and duration of energy can be carefully controlled, and it's all done automatically by the device. This allows you to deliver the most efficacious treatment possible while limiting the risk of any side effects. This is the BodyFX handpiece, which, as you can see, has a built-in temperature readout into the handpiece. The device is actually placed on the skin. It creates a vacuum, as shown here, and the radiofrequency energy is delivered. Immediately following the treatment, you can see that the skin is mildly erythematous and that it is that has been treated with the vacuum. You then sort of move the handpiece a bit over and treat the next adjacent area. Again, as I mentioned previously, a treatment area is approximately the size of one large hand. As you notice with the BodyFX, there are no disposables, so there's no additional cost to doing each treatment, or depending on how long you do the treatment, there's no additional cost. So in conclusion, the BodyFX is a revolutionary non-invasive fat treatment. It specifically targets adipocytes and is scientifically proven to cause direct adipocyte apoptosis. At the same time, it targets and remodels existing collagen. It results in tighter, more compact existing collagen, while also stimulating new collagen production, neocollagenesis. So what will you and your patients see? Well, you'll see a very nice fat reduction, decreased circumference, decreased fat weight, as well as tighter skin in the treatment area and improvement in the appearance of cellulite. And interestingly, if you want to learn more or see it in the BodyFX in media systems, Rachel Ray had a wonderful segment on BodyFX just recently, and I encourage everybody to watch that segment. So in my opinion, BodyFX is an ideal body contouring, cellulite, and fat sculpting treatment. And I hope that this webinar has been helpful so that you have a better understanding of the technology, the basic science, and the clinical outcomes associated with the BodyFX device. Thank you very much.